Thanks, all of you guys. It's quite an honor to be able to address these impressive individuals over here. I always wanted to, at the beginning of the school year, I used to be in charge of family night, and I always wanted to do this skit that showed what nurses really do. And Sue thought that I would frighten people with it. So I can't frighten you guys now. Well, maybe a little bit. But I think it's important for a family to know what nurses really do. And so the skit would take place in a normal hospital, nurse sitting at a desk, and this patient going, "So, nurse, it's time. 7:05. My medication was due at 7. If you're done with Facebook or Angry Birds, I could use my medication." And the nurse just politely smiles, gets up, brings the medication to the patient, sees that the bed isn't straight, and so they lift up the bottom covers, they tuck them back underneath their feet. Patient's like, "Okay, really, just give me the medication." Then the nurse grabs the patient's hand, looks at the name band on it and says, "Could you tell me your name and birthday?" Patient's like, "Really? You don't remember? You just asked me 2 hours ago." And the nurse is like, "I know, it's just something we have to do." Patient's like, "All right, fine, it's Doug Smith. And your birthday?" "You know my birthday? It's written right there for you." "I know, but you have to tell me." So, nurse is getting a little harassed, right? Nurse gives the medication, kind of surveys the room and says, "Is there anything else I can get you?" Patient's like, "Nope, I'm fine. Just, would like to keep my medications on time. They're on time at home. I kind of expect they should be on time here." Nurse is like, "I appreciate that. And so if you need anything else, just let me know." And they go back and return to the desk. Now, I want to tell you what really happens. When that nurse is at the desk, they're looking at things. They're not playing Facebook. They're not playing Angry Birds. Are any of you playing them now? Just checking. What they're actually doing is they're looking at the physical therapy report, because this person has congestive heart failure. This medication they're passing is Lasix. It takes fluid off of their body to help their heart to pump better. So they need to see, should I get this patient up tonight or not? And how did they do with respiratory therapy? And they're looking at the cardiopulmonary report to see if this medication has been therapeutic. They know the pathophysiology of congestive heart failure, and they know how Lasix works, where it works, and that it robs the body of potassium. So they're checking a potassium level. They're also checking the input and output for the last 48 hours to see if the patient is fluid volume overloaded or if they're dehydrated. They're looking at their BUN, their creatinine, their hemoglobin, their hematocrit. They're looking at their sodium levels, potassium levels. They understand all of this. Now, when I hit them with this last fall, you should have seen their eyes. They're like, "No way, that's not what nurses do." That's exactly what nurses do. So that's the process before they even enter the room. Then when they enter the room, they're looking at the oxygen tubing, for one thing, 'cause it's a big safety hazard. They're looking at any other safety hazards. When that nurse lifted the sheets off that patient's feet, they were actually assessing for swelling and lower edema, because that has to do with that congestive heart failure. They looked at the Foley catheter bag, and they looked at the urine. They looked at the color, the clarity, because that has to do with hydration status. They know that one of the first signs of hypoxia or problems with your heart, difficulty getting oxygen to your brain, is irritability, so they're assessing that patient if they're irritable. They're also confusion too, so they're looking at alertness, orientation, they're looking at skin tone, color, if there's any tinting, they're looking at the sclera of the eyes. They're assessing all this stuff that people don't know they're doing. All because they understand what's going on with the patient. Then when they lifted that patient's arm up, they were actually assessing the pulse of that patient to see if it was bounding, if it was thready, what was going on there. They were looking at the respirations of the patient. Were they using any accessory muscles? Were they breathing too deep? Were there any changes with just moving in bed that had to do with their disease process? That's the thought process that goes in with being a nurse. So then they gave that medication, and they asked that name and birthday because they're not just giving that one medication to that patient. They have 6 patients to care for that night, 4 of whom get Lasix at different doses and at different times. 2 who don't get Lasix. You certainly don't want to give them the wrong medication. So those safety things that nurses do are super important. So then the nurse goes back to the desktop. Everything's good with the patient. Whew, we gave that one med for that one disease process, right? You did it. That was how fall is. Now what these guys can do is their next patient, they don't have one disease process and one medication. Their next patient has chronic obstructive pulmonary disease, congestive heart failure, vascular insufficiency, hypertension, and a couple more. And they don't have just one medication they're passing 18. So they have to have the knowledge to be able to look at that documentation and be able to understand if it's therapeutic and should I give this medication, because they are the last person that safeguards people at their most vulnerable. So it's truly an honor for me to talk to you guys, because you've devoted the last 2 years of your lives to learn how to care for people at their most vulnerable and to keep people safe. That's amazing. So you might think that nursing school was a challenge, right? It did teach you one thing I think is vital in nursing, and that's how to handle constructive criticism constructively, and how to use that feedback to become better, because you guys made it. So you used that feedback and you got better and your knowledge grew. And we always talk about a learning curve. One of these guys told me it was a learning cliff. I call it the mountain. It's the Everest. It's phenomenal how much they've learned. But that challenge, there will be more challenges. As a nurse, I've been punched, I've been kicked, I've been spit at, I've been patted. I was hoping it was in a grandmotherly sort of way, but I'm not totally sure. I've been threatened, but those are challenges, and don't let that scare you, because I've also been genuinely hugged. And what's funny is I remember a baseball player came in, gave me that genuine hug, that big grab you, hold on to you hug, and I'm like, ooh, not sure who this young man is. And he says, I remember you from 2 years ago, and I just wanted to come in and thank you. And I'm like, okay, it's been 2 years. He said, I'm going to run a marathon next week. And he says, I remember everything you said to me 2 years ago when I had a diving accident and I couldn't feel my lower extremities and I couldn't move them. He says, I remember you saying, healing is a marathon. It's not a sprint. This isn't an injury you're going to heal from today in the next 5 minutes. But you can get there if you take one step at a time. So what you guys say to people and how you help people, it's with them forever, and they remember everything you say. And that gift of being able to help someone, that's priceless. And you guys are all going to do that. And so thank you for letting me be part of your education and letting me help you start it and then letting me cheer you on as you finished it. I would normally say, go out and make me proud, but you guys already have. So I'll instead say congratulations.